Hi, I'm Dave Clark and I'm working with the Kingsbridge Dementia Friendly Community on a new series of podcasts about dementia. In the first 6 episodes, we've heard about businesses, families and the church, and we've also learnt about the work of the police when looking for missing people and how hospitals have become more dementia aware. In this podcast, I'm talking with Ian Sherriff from the University of Plymouth about his training and research work, in addition to his various advisory roles, and we'll hear how dementia awareness has developed over recent years in our rural communities.
Well, my name is Ian Sherriff. I'm the Academic Partnership Lead in the medical school here at Plymouth University. My role is quite varied. I teach doctors, nurses, paramedics, dentists, midwives and physios. We're just taking that responsibility on board. And I also research. So we have 3 big research programs going on at the moment. One of those is about placing dementia support workers in GP practices. The other one is called Radio Me, and put people who are very vulnerable on a radio live link where they will be given alerts during the day. And I have another research program which is looking at the maritime world and dementia in that area. And then I have my work outside the university with the chairing Prime Minister's Rural Dementia Group, the Prime Minister's Air Transport Group for Hidden Disabilities, and I chair Plymouth Dementia Action Alliance, and I started that off in 2009, the first Dementia Friendly Community, and it's wonderful to see how that concept has grown, not only in this country but also around the world.
Can you just tell me about your work in the area of rural communities?
So I was asked to set up the Rural Dementia Group, in which I have an interest. I do live in a rural community. I was very lucky. The first meeting we had, the Bishop of, he's now the Bishop of Plymouth, Bishop Nick, actually said, well, why don't we have the first meeting in the palace, the Bishop's Palace in Exeter, which was very good because it was an autumn afternoon. Food was served and a glass of wine was had by everybody, and I think we lulled them into a full sense of security, and they all agreed to join the group and move it forward. And we moved from there to the House of Commons, and as I say, we haven't looked back. It's 14 projects on it, so I was very project focused because I think talk shops are not what I want to be involved in, and so there has been massive outcomes from that group over the last 3 to 4 years.
Take us back 10, 15, 20 years to how things were in people understanding the challenges that people have with those who have dementia in rural communities.
I can highlight it, I suppose, by why the Alzheimer's Society came into being. That's their 40th anniversary this year. And 20 odd years ago, 25 years ago, you would not have read in the newspapers anywhere about dementia. And we had to change that. We really did. So we had to get headlines. We got newspapers behind us. We got communities in rural communities. If you went back 25 years ago, then the likelihood of you being understood, let alone receiving a service, was pretty slim. And so that had to change. And it's through communities themselves that have done this. But people have taken the initiative. And so where people were lonely, isolated, didn't understand what was going on, it was very much like cancer was, where people didn't talk about it. Dementia is the most feared disease out of all diseases, even today. Whilst we've not gone over the magnificent line to say we've cracked it, we're on the road, and I get invited to go around the country to rural communities, to their alliances, their dementia-friendly communities, and they range in what they're doing. They can be really inclusive, running groups, etc., down to just a few activities. But at least that movement has started, and it's quite refreshing. I think it's not only within communities, it's professionals as well. So, we had issues around timely diagnosis or early diagnosis with GPs. That is changing, and GPs are more apt to signpost and diagnose nowadays. Services built around GP surgeries or in communities. An example is that parish councils, they're very professional, dedicated people. And the best thing about them is they know their communities. They'll know if Billy Smith or Mary there's something not right. And so where I've seen massive movements forward is where village communities have taken the initiative and gone forward. And an example of this, an example which we're very proud of on the Prime Minister's group, is the Dementia Friendly parishes around the Elm. And there are 5 parish councils. I went to see them to start with and say, look, I think it'd be great if you work together, and together you're stronger and you have resources. So they did, and today they're thriving. They have a dementia support worker who coordinates it. They have groups running every day of the week, and they're not in exclusive groups. There's not only for people with dementia but also people in the community, because the biggest thing we've got in our rural and our urban communities today is loneliness and isolation.
What are some of the areas that still need to be tackled? What are the plans?
I think the biggest plan that government needs to do is sort out the funding for health and social care in this country. They've kicked it into the long grass. There have been reports after reports saying we should fund this thing properly. I mean, why are people with dementia and their families, and we've called it a dementia tax, why are they having to fund their care and use their money from selling their houses, etc., etc.? This needs to be looked at. So that would be my first thing. I think the second thing is that, it's nothing better to observe a community actually caring for each other. I did a lot of work in North Wales, and I remember saying to the local policeman there, you could become dementia friendly and help out. And I don't want to parry too much the Welsh, but he said to me, well, boy, how do I do that? I mean, I'm busy being a policeman. And I said, if Mrs. Smith in number 36 Railway Cottages didn't show for 2 days, what would you do? Oh, he said, I'd be on the case straight away. I said, that's all we're talking about.
We've spoken about the obstacles maybe, but what are some of the more positive signs that you see?
Last year I did 52 conferences around the country, and each one of those was telling me how fantastic what they're doing in their communities. I mean, you were talking earlier on about Kingsbridge, and they picked up the cudgel and they're running with it. And Kingsbridge is a better place, I think, for having a dementia-friendly approach, because that word friendly, which was put on the tag by Professor George Giarci and I working together, and if we're more friendly towards each other as far as dementia goes, that has a knock-on effect within our communities. So I think there is lots going on. It's sometimes not highlighted in the press. I'm very optimistic. It does your heart good when you see what's going on.
And how are we comparing with other European countries?
Well, if I take not only Europe but globally, the world, I chair a global group, and they're all looking at us, which is very interesting. Clearly, there are countries around the world that are pushing ahead, and I have a lot of friends in the Netherlands, and the Netherlands are really pushing it in their communities, and are doing exceptionally well, and we've learnt from them. If I work in China, and now China is on the, trying to emulate what we're doing. In Japan, I was in Japan not too long ago at their national conference for dementia, and I pointed at the press and said, you're the problem, because it's the way you report dementia actually stereotypes it. Mm-hmm. Having said that, I'm getting lots of feedback of what Japan is up to, and they're moving forward. So I think it's patchy across the world, but people are desperate to learn from us, from each other.
Is there less awareness in general in rural communities than there is perhaps in a sort of urban environment?
No. What we have in our rural communities is the bit about lack of services in certain areas. support services. And that was highlighted. I was very lucky. I did a small piece of research with some people here at the University of Plymouth, and we were looking at dementia in the farming industry. And quite clearly, farmers are quite known for not going to the GP, or going to the GP when it's too late. And then you had to think about, well, what services do they have to support them? And that was quite isolating. You know, there wasn't anything that was going out. But I've got to say that people like Rabbi, Royal Agricultural Benevolent Institute, Community Farming Network, now are moving forward on that. So I think if there is anything that needs to be beefed up, it's the support services that people use or need in our rural community. Travel is a big thing in our rural communities. You know, you can do, say, 3 visits in a day in a rural community, where you could do about 10 or 12 in an urban community because you live closer, you don't have the miles to travel. But I'm optimistic that the amount of work that I see and the amount of planned work that's going on, that we're on the road to crack some of this stuff.
And what about for minorities? Would they find it even more challenging to find help and resources?
People with dementia are people with dementia. It doesn't recognise class, creed, religion or anything. It's there. So where I've seen it, that hasn't excluded people. Where I know there's a lot of work going on in our big cities around that. And there's some good work been going on in London by the Alzheimer's Society, as in Birmingham, other big cities as well.
For those living in the countryside, what can we do as individuals and as a society to help?
I think as individuals, it's your neighbour is your neighbour, and don't want you to go and rush around and knock on the door. But what I want you to do is understand what their plights that they're going through, the stresses and strains of caring for somebody with a dementia. It's 24 hours a day, 365 days a year. There's no respite for their carers or the families. So just bearing that in mind, that you as an individual, what can you do to help that individual, help that family? I would say to communities, there's a lot of community activities that you can mirror that are producing the goods. So find out where that's happening. I do think, the West Country down here, you're doing a fantastic job.
How can people find out more about your work?
Just go on the university website and Google Ian Sherriff, and it should all come up. And and it's been a very good year for me this year. I was in the Queen's Birthday Honours list for what people said my work, but I actually do think it's about the work that we've done as not only here in the university but in the communities around.
Where do you think we'll be in 10 years' time?
Well, if it had done 10 years ago, where we'd be, and we're getting there, whilst we won't have reached utopia, but I can only see good things happening. What worries me, though, when I say that, is everything that I see being built around dementia friendly communities and all that, they've got to be sustainable. There's nothing worse than starting something up and then going back 2 years later and saying, why has it failed? Well, because Fred or June has left. We've got to build in the sustainability element to all we're doing. If that is done, then we're going to look forward to a brighter future.
Thank you very much.
My pleasure.
If you would like to find out more, please search for Kingsbridge Dementia Friendly Community. This is a How production. Please share and subscribe.